Bismillahirrahmanirrahim. So our today topic is aseptic dispensing. Do you know what's aseptic? An environment which is free from microorganisms. So we have 4 subtopics in this chapter. First one is IV admixture or IV additive solutions. Second one is total parental nutrition or hyperalienations. Third one, cytotoxic drugs dispensing. Fourth one is semi-sterile dispensing, eye drops or ear drops, whatever it is. So you may have an experience during your life that some have gone through, they become ill, they went to a general practitioner and he used to have applied some injectables. Sometimes he applied injectables on your arm, sometimes on gluteal muscles. So they have various type of injectables which are applied on different routes of administrations. Now, IV admixtures, these are larger volume injectables. They are larger volume injectables, mostly applied to the patients. So sometimes whatever they have to add some more injection. So that is IV additive solutions. So I can show you various dosage forms of parenterals. They are available in 2 types, single dose containers and multiple dose containers. 2 types, one is single dose containers and second one is multi-dose containers. Now you can have experience of various glass ampoules. Some vials have rubber stoppers. Some have glass and plastic bottles are nowadays in the market. Glass and plastic syringes are available now. Fifth one is, nowadays you can have seen various vaccine in pre-filled syringes. Mostly these injectables are applied with the help of a device. That device is known as disposable syringe. Earlier they were using glass syringes also, but it was to be sterilized before applying that glass syringe. Nowadays you may have seen disposable syringe. So what you have to fill that drug from ampoule or vials in a syringe, then you have to apply it to the patient. Here nowadays some drugs are pre-filled syringes, or in good hospitals the drugs are reconstituted. The drugs are reconstituted in syringes or other devices. They are applied to minimize the scope of pilferage, because when drug is dispensed from pharmacy, it used to go to a ward. Sometimes it can be pilferage. So in good pharmacies, these drugs are reconstituted. These drugs are reconstituted in disposable syringes or other devices, and they are then dispensed to their respective parts. Now you can see this ampoules and vials. Go further this, you can see these are known as, you can know the differentiate between ampoule and vial that you learn in industrial pharmacy. Ampoule is a different shape and vial has a different. And nowadays still plastic ampoules are also available nowadays. Their pre-filled syringes are also available nowadays. So these are mostly single dose containers. Mostly the ampoules are hermetic sealed by heat fusion over there. Ampoules or vials, they are sealed. Now you can see over this picture, there's a pre-filled syringe. The multi-dose containers, you can see that in mostly the people who are taking insulin, mostly the insulin is available in vials, and there was the pre-filled injectables, pre-filled syringes. Insulin available in pre-filled syringes and in vials. Or cartridge. Some insulin are available in cartridge. That cartridge is placed in a device, then they have to apply it. So what you have? Vials, they are pre-filled syringes or pen types. Third one is cartridge. The cartridge is placed in a device and then you have to inject the insulin. So these are multi-dose containers. Now, these all are in a good hospital, in a tertiary care, a quaternary hospital, these all are filled, are reconstituted in a aseptic condition. Now, most of the department have aseptic rooms. They have various devices. Their laminar hood is there just to minimize the chances of contamination. The drugs, when they are reconstituted, they may not be contaminated. So you can see that how the people are filling the injectables in that aseptic area, aseptic. So many devices are available in that aseptic areas. Now you can see that how they are filling that injectables, drips, larger volume injectables. Here you can second, and mostly they are wearing their they are wearing this type of clothes, dresses, PPAE. These are the various type of dresses they have to wear before going to reconstitute the drugs for dispensing towards the various wards. Now, what's the aseptic technique? You may have learned the aseptic technique. Now, what happens that bacteria, viruses, and other organisms that cause diseases are known as pathogens. Now, to protect patients from harmful bacteria and other pathogens during medical procedure, healthcare providers use aseptic technique. Aseptic technique means using practices and procedures to prevent contamination from pathogens. It involves applying the strictness rules to minimize the risk of infection. Healthcare workers use aseptic technique in surgery rooms, clinics, of outpatient care centers, and other healthcare. Wherever they have to apply these things, so area must be free from microorganisms of all types. Now, sepsis. You may know before, when you know antiseptic, you must know about what is sepsis. Sepsis is a life-threatening illness caused by a body response to an infection. The immune system protects from many illnesses and infections, but it is also possible for it to go into overdrive in response to an infection. Sepsis develops when the chemicals the immune system releases into the bloodstream to fight an infection, cause inflammation throughout the entire body. Instead, severe case of sepsis can lead to septic shock, which is a medical emergency. So, आपको मालूम हुआ कि sepsis क्या होता है? Sepsis के whenever microorganism invades, infection produce करेंगे, तो उसकी body response में they produce sepsis. Technique where these techniques are mostly used. Now, mostly they are used helping with the baby's birth by vaginal delivery. So that area must be aseptic. Handling surgery equipments, handling dialysis catheters, performing dialysis, inserting a chest tubes, inserting a urine catheter, inserting central intravenous or arterial illness, inserting other draining devices, performing various surgical tests. So wherever when you come in contact with the patient and you have to apply some procedure, it must be in aseptic technique. Technique must be free from microorganisms. You can say how these drugs are applied to a patient, but they have to clean that area, skin, then they have to inject. Preparation in the middle pick, that is preparation of the injectable. Then they have preparation of the area where it is applied. Then they have to introduce that drug inside in that area. Now, what we say about admixture preparations? Now, mostly sterile IV solutions that are prepared by using one or more in medications or electrolytes and will be administered via the parenteral routes. You may have seen your relative becomes ill, they were admitted to hospital, they were inpatients, but they are applied drips. Now, sometimes they add some other injection also. They add some other drugs, injectables in that drip. So these are additives. These are various additives. So solutions that are prepared by one or more medications or electrolytes and will be administered by the parenteral route. So they are additives. Now earlier they were using irrigation solutions, ophthalmic solutions, intrathecal solution. These are our sterile products. So if you say intravenous admixture preparation, how they prepare? The compounding sterile admixture medication has originally started to prepare sterile intravenous, intrathecal, ophthalmic, and irrigating solutions that were not available commercially. So it earlier, they have to adopt procedures that they apply sterile admixture medications. Now, mostly in 40% of hospitals, inpatient receives intravenous preparations, including replacing fluids and electrolytes, provide nutrition, and administers medications. It can be administered in the hospital or to patient at home. So mostly the patient who could not take the required nutritions or whatever electrolytes mostly, so that can be given through intravenous administered preparations. So what's the pharmacist's responsibility in admixture preparations? What they have, the drugs must be free from contamination. They must know about compatibility. The pharmacy, now the pharmacy must maintain a clean area out of the direct flow of traffic with a vertical or a horizontal laminar airflow hood to prepare IV admixture. So must be free, the area where they are going to reconstitute must be free from any contamination. So that's why they have to refill under a vertical or horizontal laminar airflow hood to prepare IV admixture. Now, mostly there is a three types of compatibilities: physical, chemical, therapeutic incompatibilities. So pharmacy education should prepare pharmacists to deal with the problems of these incompatibilities. Pharmacy responsibilities in admixture preparation: stability. Now, whatever the drug, it must be stable. The drug which are reconstituted mixed must be stable. Drug stability information must be readily accessed to the pharmacist in order to determine optimum condition for drugs storage period and after preparation. Keeping a drug at ideal storage conditions will help to establish a responsible expiration date for the products. Inspection method to test product sterility and overall integrity must be stated. So that must, the drugs now it must be stable. That's why they have different shelf lives. The drug which is prepared under the aseptic techniques must be stable for the required period. Now, what is the pharmacy system process? Check the solution against original order. Whatever prescription had been received, now you have to find out that stocks, then label original prescription. Whatever the label was required, then determines its dose, diluent, rate of administration must be given over there in this. So we have three processes: check the solution against original order, label against original prescription, then determine you have to write the pharmacist after prepared mixture, dose, diluent, at what rate it has to be applied in a patient. Now, quality assurance must, the drug which is prepared or reconstituted in aseptic techniques in a hospital must have a quality assurance. The system check aseptic environments and the pharmacist's access to both patients' profile and final products provides more stringent quality control over parenteral therapy. Admixture of drugs not available commercially can be prepared using the powders from. The resulting solutions should be filtered and before addition to internal bank. You have know about extemporaneous preparations. I've told you that in previous classes that extemporaneous preparation, when the drugs is not available commercially or in finished forms, that has to be prepared in a hospital under supervision of a pharmacist. So the pharmacist must assure the quality. Whatever the drug he has to reconstitute, they prepare must be have a quality standards. Now, what intravenous admixtures? It's a combination of one or more sterile products added to an IV fluid for administrations. You can see that the bags are hanging on a IV stand. So they have to be added some more drugs which are prescribed by the doctor. Intravenous admixtures must be sterile and free from pyrogens since it will be administered into the body. Aseptic technique is used to mix the product. So with these has to prepare, the has to add under aseptic technique where free from that area must be free from microorganisms. Pharmacists must be knowledgeable in preparing a form for the combination of drugs and IV solution that will be suitable for administration to the patients. Products used in preparing the admixtures must be sterile and not contaminated. Proper conditions for aseptic handling can be provided by laminar flow hoods. IV push and IV infusion dose forms are prepared in the laminar flow hoods. Now, what happens that a pharmacist who are going to prepare an admixture must have a knowledge how to prepare the IV solutions. Now, products used in preparing admixture must be sterile. These are their sterility must be controlled. That's why they have to use a aseptic handling. So that's why in certain cases you have seen that they have to these drugs are injected through the IV set. You have seen that drips are mostly used through IV set. In case of small injection, they can be applied, can be used through the disposable syringe. But the larger volumes cannot be handled, cannot be administered through that one of disposable syringe. So that's why you need IV push or IV infusion dose form, or you in normal language that was IV sets. So these are prepared under a laminar flow hoods to maintain the sterility of that drugs. Now, what the pharmacist has to do before the preparation of admixture? Both hands must be thoroughly clean. Accessories, jewelries must be removed. Gloves must be used during the procedure. Laminar flow hoods must be kept running. All surfaces of the work area must be cleaned and disinfected. During the preparation of admixture, now this have to do before. Now during that, what you have to do? One must work in the center of the area within the laminar flow hood. Proper procedure must be followed in handling sterile devices and containers. Now, in that aseptic area, the 5 things which I've written over there, they have to follow these things. So before the preparation of admixture and then during the preparation of admixtures. Now, but after preparation, the plunger and the tip of syringe must not be touched for their sterile. One must use the smallest syringe which can hold the desired amount of solution. Additives may be packaged in vials or ampoules. Now the additives are mostly in their smaller quantities can be added. So they may be added through vials or ampoules. After preparing a mixture, properly dispose used gloves and syringes. Now these things has to be disposed of. They have to be thrown out. They cannot be reusable. So clean the work area. Now after completion of that, they dispose of gloves, whatever the disposable syringe they have used, and then clean the work area. How to draw liquid from a vial? You most have seen that how they draw the liquid from the ampoules, how they draw the liquid from vials, and then they have to add to that drips or infusions. Now choose a small gauge, needle and handle carefully the rubber top of the vial, thus preventing particulates. Now remove that lid and then choose the small gauge, needles and handle carefully the rubber top of the vial. Attach needle to the syringe. Now draw into the syringe an amount of air equal to the amount of solution to be drawn into from the vial. Now what? You have to add some air insert inside that vial. Now you can see in this picture that how the drug is drying from a vial. Now the needle is pushed through the rubber lid. Then the air 0.4 ml is injected into the bottle of the medication, creating a light pressure, overpressure, because that is fixed. So when you add some air, it increases the pressure. When you take out that drug, it has to come easily in that syringe. Swab alcohol on the top of vial, enter the laminar flow hood, puncture the rubber top of the vial with the needles, bevel up, pricks, needle and syringe straight up. So what you have to do first? you have to place swab. You must always spread swab or alcohol swab place over the vial just to clean that area. Then enter the laminar flow hood, puncture the rubber top of the vial with needle, be bevel up. So what? You have to clean that area of the vial, then you have to insert that syringe and under a laminar flow hood. Is it clear? Now what will penetrate the stopper? Then depress the plunger of the syringe and penetrate the air to the vial. Invert the vial with the attached syringe, then drop the required amount for the preparations. Now, how you have to take out first? You have to see in the previous picture that how they have inserted the syringe. Now, how they are taking out the drug from a vial. Slow overturning of the bottle without shaking to avoid the appearance of a bubble in the solution. Second, slow uptake of medication up to the level marked on the syringe. Now they have to take out their drugs from that vial. Withdraw the needle of the syringe. Now the required amount or quantity you have taken. Then what you have to withdraw the needle of the syringe from the vial. Remove and properly dispose the needle and the cap of the syringe. Prepare the product by introducing the withdrawn drug from the vial into the IV container. Now, what is the drug amount which we have drawn from that vial? It has to be introduced inside that IV container or drip or infusion bag. Now, similarly, that was for vial. Now, how the drugs taken from the ampule, then it has to be introduced in that drip. Now, what we have to do? Carefully tape the top of the ampule so that medication will settle on the lower portion of the ampule. Clean the neck using an alcohol swab, then grasp the ampule between the thumb and index finger at the neck with the swab still in place. Forcefully snap the neck away from you. So how to remove that neck? Similarly, you can see in this picture that they have removed that neck of the ampule to draw that drug from that ampule. Pressure can be applied at any point above the ring on the thicker part of the neck in a backward direction. Do not hold too near to the ring and careful of the glass during the breaking. So you have to remove the neck and then you have to draw that one drug from the ampule that will introduce in that infusion bag. So tilt the ampule, then place the needle bevel of a filter needle or tip of a filtered straw in the corner near the opening. Withdraw the medication. Now you have to use that syringe to take out that drug. Particles, fibers, other materials which may have fallen ampules must be free from that. Before putting the content of the syringe to an IV, IV bags, prevent induction of particulates into that admixtures. Now then after doing that, in that drip, you must have to label. Label for admixtures should contain the following information: patient's name and identification number, its room number wherever it is required, fluid and amount what is required, drug name and its potency, infusion period, flow rate, on what rate it has to be applied to the patients, expiry date and time, any information or required, it has to be written on that label. So I think we hold up to here.